Hello everyone, this is Shalu Kumar again from ONTC. I'm an experienced OSCE nurse trainer for the NMC OSCE exam in UK and also the lead trainer for OSCE nurse training Cambridge. Today's video I will be covering A to E assessment. Okay, so that's the part of your assessment station, but I will be concentrating on a particular part of your assessment station, which is A to E assessment, which is a very important part of your assessment station now. So I will be talking about that today. So okay, if you like my videos, please press the like button now and subscribe to my channel. It just gives me a lot of motivation to keep making some good videos for you to revise for your NMC OSCE exam. So let's talk about today's video. So in today's video, I will tell you how to do comprehensive A to E assessment, which is part of your assessment station. So I'm not going to go through full assessment station because I've already done the video on that. So please go ahead and watch that video. But today we're just going to concentrate little bit more in detail on A to E assessment, because lots of fails have been happening in exam centers because nurses are not performing comprehensive A to E assessment as per the marking criteria. Okay, so I'm going to show you as per the marking criteria how to complete A to E assessment as part of your assessment station. Okay, so let's look at airway first. So if your patient is talking to you, obviously you will say that you're talking to me, your airway looks clear, there is no obstruction. So that is fine. I'm happy with your airway and that you're maintaining airway, and then I will move on to breathing. So in breathing, what kind of things we look at? First thing is you need to tell your patient that you're gonna check their respiratory rate and check the respiratory rate for 1 minute and tell the patient what is the respiratory rate, unless you have already done their vitals, so you can use those vitals. So and then you will talk about the rate and also the rhythm of respiration was irregular and also the depth. Okay, that is, there is no excessive shallow breathing where your patient might be breathing too shallow and not breathing with a rhythm of good depth. Okay, so you're going to look at that, looking at your actor's chest here. And second thing, you need to look at the oxygen saturation level. So tell your patient what is their oxygen saturation after doing the oxygen saturation level. So that would be part of your breathing assessment. If your patient is on oxygen, then do mention how many liters and advise your patient to continue with the oxygen therapy if that's your scenario. And then third thing we look in breathing is the respiratory noises. So that's really important, because it would be a critical fail if you just only mention the respiratory rate and oxygen saturation. You really do need to do comprehensive breathing assessment. So you will look at the respiratory noises. So you're looking and talking to your patient, ask them if they have any or wheeze, can you hear anything on their chest, any stridor or any cough they have recently. And then obviously you could look at movement of their chest. So look at your actor's chest and see that it's not moving unequally and it is moving, the both sides are moving at equal of their chest. And then look at your any signs of visual signs of respiratory distress, like looking at your actor, you will be looking that they're not using any accessory respiratory muscles, like they're not using their diaphragm. So because that would normally give you a seesaw breathing. If your patient is struggling and they're using accessory muscles like diaphragm, then their chest is going to look like there is a seesaw movement breathing. Are they sweating or there is any color change, any cyanosis? You will be looking at that. Okay, so that would, because if they're not breathing and taking good oxygen, that their skin might look blue, their lips or anything else. So that's what we need to look at, because that would be our cyanosed patient. So your actor, so you're looking at your actor and you are looking at all these things and verbalizing all these things. Okay, not just the respiratory rate and the oxygen saturation in breathing. Okay, so next we're going to move on to circulation. So in circulation, which is C, obviously the first thing is to do the heart rate for 1 minute. and then tell your patient that. And then also not just the rate, you're going to tell your patient how was the rhythm was regular and the strength was good. So if that's what you have found when you did your 1 minute of heart rate, then say that to your patient. Then you're going to mention the blood pressure. What is your patient blood pressure? You do it and tell your patient. And then also capillary refill. So you need to do capillary refill as part of your A to E assessment. And then press on the finger for 5 seconds, and then once you leave it, then the circulation, the color should be back within 2 seconds. So tell your patient that you have done the capillary refill and it is less than 2 seconds. Okay, and your patient doesn't look pale and your patient is looking well perfused, so you do need to comment on that. Okay, looking at your patient, you will say, okay, you look well perfused, your skin looks perfused, and so that's okay. So that's your circulation. Then you're going to move on to, because if they're maintaining good blood pressure and they have a good heart rate, their skin should be well perfused. So you've done that. Then we're going to move on to now our next part, which is the disability. So disability is all about the conscious level. Okay, so we look at so you're going to check on their conscious level using ACVPU, which is for alert, A for alert, C for confused, V for voice, P for pain, and U for your patient is unresponsive. Okay, so you're not going to get any body unresponsive in your exam, but or anybody who just only response to pain or voice, because your patient will be talking to you in your OSCE exam. So you're going to just need to work out whether your patient is alert or confused. Okay, so if you are in medical surgical scenario and if your patient is talking to you and they are talking and they're answering your question and you have no indication they're confused, then obviously they're alert. So if you get a neuro scenario and if you have done a GCS score on that patient already, or you will complete your Glasgow Coma scale on as part of your assessment station, and if you found them confused in that, so obviously that then they have confusion. So just work out, is your patient alert and talking to you and answering all your questions, and they don't give you any indication they are confused. Otherwise you can check their confusion levels. But if you get neuro patient, they might be confused, they might not be, but it might be. So you will comment on that, whether your patient is alert or confused. And the next thing, we're going to look at the pain. So this is big part of disability, that you do your pain assessment, check with your patient their pain level using pain tool 0 to 10, and then if they are in pain, just tell them that you will give them appropriate pain relief. And the next thing we look at in disability is blood glucose level. So you're going to ask your assessor for this information, if they can tell you what is your patient recent blood glucose level. Okay, so because glucose levels can have a huge impact on our alertness level. Okay, because if a patient is diabetic and they got unstable blood sugar level, that would definitely have an effect on their alertness level, and that might make them confused. Okay, so you're going to check for the blood glucose and also for the urine output, because we know the renal patients, if they don't have good urine output, that can actually have an impact on their conscious level, and that can make patient confused. So we're going to ask the assessor for the urine output. Okay, so you will ask, hopefully it would be normal blood glucose and urine output in your exam. And then next we're gonna move on to the last one, which is exposure. So exposure is all about working out if your patient is at risk of developing a kind of generalized, like kind of sepsis, okay, infection, but generalized like infection, like risk of developing sepsis. So we look at temperature is the first thing. We need to know if your patient is pyraxial. So you would go ahead and check their temperature and look at that. So we'll say your temperature is this, and then we're going to, so in the instruction in assessment station on your template, they say don't ask your actor to take any clothes off to look for exposure. You can ask your examiner for additional questions. So you can ask the examiner if your patient has any presence of any bleeds on their body, any bruises, any rashes, or any injuries, because that could indicate a development of sepsis. Okay, that your patient may be developing sepsis. So you will ask those questions to your examiner. Another thing we need to do in this is, which lots of nurses are forgetting in exam, and is a critical point, is looking at patient medical history. Now, why we look at medical history as part of exposure? Because we know certain medical condition can put you at high risk of developing sepsis, like if patient is long-term diabetic or chronic heart failure, or somebody who's got COPD already, or who's got underlying infection already, and whether it's chest infection, whether it's some kind of wound infection. So that would put you at high risk of developing sepsis, or anybody on immunocompromised condition, autoimmune diseases. So you do need to look at your patient medical history. For that, you are already given patient overview history form. So just go to that and read the medical history and look at it. Is there any condition which will put your patient at risk of developing sepsis? So that kind of completes our A to E assessment. Make sure you do it very comprehensively. So my top tips are, don't, understand your marking criteria. Don't leave any of the elements. Okay, don't think A to E assessment is very quick and I can just mention breathing rate, respiratory rate, blood pressure, saturation, and that's that. No, it's a comprehensive assessment, and it's a very systematic assessment. So my top tip will be, learn your marking criteria. Second top tip will be systematic, and third, the top tip is time management. Okay, make sure that you know your marking criteria enough, and then you can very quickly go through your A to E assessment and don't miss any part. So that would be the time management. And my fourth tip will be very clear. So just when you're verbalizing all these things, be very clear in your verbalization so your examiner can hear you clearly. And my fifth top tip is, don't forget you have a patient as a real actor as a patient. So look at your patient and do all this assessment on your patient, with your patient, and of course you can ask your examiner certain questions, but otherwise it is with the patient you're doing A to E assessment. So hopefully you like my top tips and this station. So if you like my video, please press the like button now and subscribe to my channel, and I will soon be back with another video for you. And you can also visit us on osceatraining.com. So bye for now.